All right, today there are new guidelines for women when it comes to getting screened for breast cancer. The U.S. Preventive Services Task Force has lowered the recommended age now to 40 for most women of average risk. Before this, guidelines were set at age 50, so a big change here. And this reinforces that early detection can help to reduce the risk of dying from this disease. Joining us now to answer some of our questions about why this decision was made and how it might be able to help a lot of women is breast surgeon with Baylor Scott & White Health, Dr. Caitlin Bokhari. Thanks so much for being with us here this afternoon. This is a big change. Wasn't totally unexpected. From your estimation, why was it important for this task force to take a look at these guidelines in the first place and update them and make this change?
I think it's important because it is that is the early detection of cancer saves lives. We detect things at earlier stages, women will live longer, and the updating of the recommendations really reflects, I think, recognition of this, and it puts it a little bit more in line with the other guidelines by other committees and things that have been published there. A lot of practitioners we've been following, and so a lot of ladies have been getting mammograms at 40, and by standardizing this kind of based on the task force, I think nationally we'll be able to save a lot of lives.
Now, we know that the age this task force recommends screening for women is now 40, but okay, so we set that age. Now, what do we tell women as far as how often they should be getting these screenings done?
Yeah, so based on the updated guidelines out at least every other year, if not annually, we still recommend based on, again, a consensus of all of certainly this is something that can be personalized based on a person's individual risk. The average woman annually or biannually, but certainly women who we identify to be at higher risk through programs like the high risk program at Baylor, perhaps they need more frequent screening or different modalities.
Okay, so every other year at least, but certainly annually is the gold standard there then. Last question for you. The updated recommendations do not apply to people with a personal history of breast cancer. What's your advice there?
Correct. So certainly if you have a personal history of breast cancer, my advice is to work closely with your breast provider, whether that's your surgical or medical oncologist, to keep up with the recommendation screening based on your personal cancer history, which certainly could be more frequently than a year. But again, I would work with your personal physician on those recommendations.
Okay, so work with your personal physician if your family has a history of breast cancer as far as...
Well, if you have a personal history, if your family has history,
I see.
then I think you can also get a personal recommendation, but certainly you want to work with a
Okay,
provider on it.
so if you have a personal history, you definitely want to work with your particular physician on the age and frequency of those. Thank you so much, Dr. Caitlin Bokhari with Baylor Scott & White Health, and apologies for the audio, a little bit hard to understand there. Thanks so much for being here with us this afternoon.
Thank you so much for having me.